Ladies and gentlemen, I extend a very warm welcome to each one of you to the Sustainability webinar on Planetary Health, where we gather to explore the vital intersection of sustainability and the well-being of our planet and people. It is indeed a pleasure to have you all here today for this significant dialogue about the health of our world and the sustainability of our future. Thank you so much for gracing with your presence. Our distinguished speakers for this event are Mr. Soumitra Ghosh, the country head of ABT Associates, Mr. Manish Mitra, the country director of Pathfinder International, Mr. Sujay Santra, founder and CEO of iKure, Techsoft Private Limited, Mr. Golden Franklin, Associate Vice President, Innovation and Strategy, iKure, Techsoft Private Limited, team members of iKure and also members of Bharat Soka Gakkai. First, I would like to invite Ms. Jaya Rao, Head of External Relations, Media and Sustainability from Bharat Soka Gakkai to deliver the opening remarks.
A very good evening to our distinguished guests and members of Bharat Soka Gakkai. A heartfelt welcome to today's sustainability webinar on planetary health, a collaborative effort between iKure and Bharat Soka Gakkai. Today we gather here with a shared vision, a vision that transcends boundaries and unites us in the pursuit of holistic solutions for the formidable challenges posed by the climate change in the Sundarbans. On behalf of Bharat Soka Gakkai, I would like to wholeheartedly welcome our esteemed guests, Mr. Soumitra Ghosh, Chief of Party USA Afghanistan, Mr. Manish Mitra, Country Director India at Pathfinder International, Mr. Sujay Santra, Founder and CEO of iKure Techsoft Private Limited, Mr. Golden Franklin, Associate Vice President of Innovation and Strategy at iKure Techsoft Private Limited, Ms. Srisha Bhattacharjee from iKure, Mr. Vishesh Gupta, Chairperson, Bharat Soka Gakkai, and finally, a very warm welcome to all the members of Bharat Soka Gakkai. Bharat Soka Gakkai as an organization promotes peace, culture, education, and sustainability through the BSG or SDG initiative. We organize sustainability-focused exhibitions and establish SDG clubs to cultivate a culture of sustainability and empower individuals, especially the youth. Our BSG for SDG mobile app dedicated to sustainability includes a very interesting feature of carbon footprint calculator. We also produce a bi-monthly newsletter focused on sustainability themes and topics, and we host webinars and symposiums to attain the 2030 SDG targets by spreading awareness about them. iKure is a population health management company that addresses primary healthcare and prevention needs through a unique combination of health outreach initiatives, skills development, and technology intervention. iKure focuses on meeting primary healthcare needs in all settings, rural, semi-urban, and urban areas. iKure's recent initiative provides primary healthcare services to underserved populations in the Sundarbans. While working, they discovered challenges beyond healthcare, including issues related to education, sanitation, employment, and limited opportunities for women and girls. Climate change is also impacting the Sundarbans. iKure strongly believes that a comprehensive solution is necessary to address all these aspects. In pursuit of this holistic vision, iKure and Bharat Soka Gakkai have come together hand in hand with a shared mission to make a positive and lasting impact on the lives of Sundarban communities, addressing the multi-dimensional challenges stemming from climate change. Through this collaboration, we aim to leverage our combined resources, expertise, and unwavering commitment to create a more significant and enduring impact in the region. Yet, we understand that the magnitude of the challenges in the Sundarbans demands a collective effort that extends beyond our organizations. Dr. Daisaku Ikeda, the founder of Soka Gakkai International, has long championed the importance of unity and collective action in addressing the world's most pressing issues. He once said that global warming is a pressing issue that threatens the well-being of our planet and all its inhabitants. To address this crisis, we must come together as a global community, transcending boundaries and differences. By fostering cooperation and promoting sustainable practices, we must mitigate the effects of climate change and protect our environment for future generations. We recognized that the challenges of the Sundarbans require collective action. Dr. Daisaku Ikeda also emphasizes on unity and dialogue to address global issues. So our webinar aims to foster new ideas, partnerships, and initiatives. In conclusion, the Sundarbans challenges concerns each one of us. Our actions today will shape the region's future and the planet. Let's commit to holistic solutions and collaborations, working together for a resilient, sustainable, and inclusive future. Together, we can make a difference. Thank you for joining us today. Over to you, Alicia.
Thank you, Ms. Rao. I invite Mr. Sujay Santra, founder and CEO of iKure Techsoft Private Limited, a visionary behind iKure, a healthcare technology solutions company based in Kolkata, India. With over 12 years of experience at IBM and Oracle, he founded the iKure in 2010. Mr. Santra has impacted 26 million lives across India and expanded services internationally. He has received prestigious awards, including an Ashoka Fellowship. I request Mr. Santra to show the presentation on Planetary Health.
Thank you so much, Bharat Soka Gakkai, Vishesh ji, Jaya ji, and the entire BSG members for giving us this opportunity to share our journey. As a disclaimer, I must tell that I'm not an expert in planetary health. We have many experts in this webinar and at the same time throughout the world. But one thing that I must tell is that as a practitioner of health on the ground and seeing up close and personal the challenges that we have witnessed, especially in the last 1.5 years, 2 years, one thing that we have shared is that when I discussed this with Vishesh ji, Jaya ji, that the problem of Sundarbans, the problem that has been plaguing in this terrain must be shared across much wider audience, such as the BSG members. So now the time has come wherein we can share our work in the last 1.5, 2 years of our journey, especially in the Sundarbans region. So we all have been speaking about the climate change. We have been seeing and witnessing in different print media, television media, and others. But frankly, as an individual and as the community members of our Mother Earth, we were not really sure that as an individual, what all we would be able to do to really stop the impact of climate change on many aspects, and especially with regards to healthcare. There has been a lot of discussions that we have seen, especially I have attended multiple forums in India, internationally in New York and others, wherein there have been different discussions and dialogues, even in Davos, that we must do some things on the ground. But very little of the work has been really working on the ground at the unit level. If you look at the different healthcare indicators, especially in the last 5, 10 or years and more, we have seen that the extreme weather conditions has had multiple repercussions on health conditions. And if we are able to pinpoint the whole journey of the last 30 years, especially, we have seen that there has been many conditions that has been plaguing the society, especially for the underserved population beyond Tier 1 region, wherein iKure has been operating. Today's discussion and webinar is on Sundarbans. Sundarbans, even before 2.5 years ago, I have never visited Sundarbans. For us, even for people in Calcutta, in West Bengal, Sundarbans is a place, the land of tigers. It's a place wherein in winters we go out to visit for picnics. But for the first time, I remember in November 2020, when we landed in one of the islands of Sundarbans, and I got an opportunity to interact with around 30-40 women, village women, and we discussed the problems that as iKure, who has been working for several years within the primary healthcare, what all we would be able to do. This islands has, for the Indian size, around 102, out of which 54 are inhabited. And many of the islands are very remote and very, very difficult to reach, especially during the monsoon season, starting from July to around October, November. In the last 2 years alone, 4 cyclones has devastated, and we all have seen multiple news that has spread across the news media. And we remember these cyclones and we say that, okay, what are the apathy that the people has gone wrong? But when we discuss the problem with this village woman, we saw that the multiple problems that are still plaguing the community and the society. Every such cyclone, every such devastation had brought in saline water into the farmlands. And that makes the farmlands infertile for almost 2 years to 3 years. That has washed away their entire livelihood, like the livestock, such as the chicken and poultries. And especially for the male members, they have been going out, or they have been forced to go out of the Sundarban region in search of work, be it in Bangalore, Delhi, or other cities. That has made the population, especially the women and children, left behind, leaving them vulnerable. There have been many factors with regards to the challenges, with regards to the health of the impact of climate change, especially with regards to the geographical conditions. We are operating in some of the islands, and these islands has lost close to 30 to 40% of the land mass in the last 25 to 30 years. And they really don't know that what is going to happen in the next 30 to 40 years from now. There has been conditions of livelihood about which I have just mentioned. Healthcare is one of the major factors in the challenges that has been plaguing in the areas of Sundarbans. And definitely on the infrastructural challenges, there are many islands wherein it takes almost 6 to 7 hours by boat. And that too, when there are clear skies. The boats are operational from morning, let's say 7 a.m. to 12 noon or 1 p.m., especially during the monsoon seasons. And God forbid, if any patient is fallen sick beyond those hours, only God could save them. So iKure has been working with the frontline community health workers since the 2015-2016. For us, who are these community health workers? Just to give an example, this lady, Sumana Murmusi, has been working in one of the villages in our iKure intervention area. Before she turned and became an iKure community health activist, she was just a homemaker. But then iKure has been able to identify, select, and train this village homemaker as the community health worker. And now she is equipped with medic bags that has various essential medical equipments and smartphone loaded with our own indigenous application. So when our health worker is able to go to a patient's doorstep, she is able to work on community mobilization and awareness, especially for the population beyond tier 1. The lack of right communication and right information is a major barrier and the challenge. And then if the patient needs access to healthcare, she is able to capture different sets of vitals onto the smartphone and then enter the data into the platform. And if the patient needs access to the doctor, she is able to connect with the doctors via telemedicine, what we call as an aided telemedicine. So now the doctor is able to get all the data, and the health worker can, in many cases, is able to translate the language, because in many cases, the doctor and the patient may not be able to speak the same language. So our health worker acts as an intermediary. Post the consultation has been done, the patient is given the prescription given by the doctor, as well as if the patient needs access to medicines, the medicines are also being given. So in a way, we are able to complete the cycle, right from spreading the right kind of information to the patients and the communities. They are captured, the vitals, the medicines are given, prescriptions are given, they are able to speak to the doctors on time. I remember the period around 2015-16 when we just started with the health workers. During that time, one of the challenges was, is it really possible to transform a village woman and make them as community health workers, equip them with different devices? And this was the period wherein we really figured out at some point that it was impossible to do that. But now in several years of our journey, we have made impossible possible through multiple innovations on the ground. We know for sure that even in the next 50 or 100 years, the availability of the doctors in each and every village in our country is extremely difficult. The only that we would be able to solve problems like pandemic is if we are able to train and deploy such frontline community health workers, we would be able to solve a major part of the healthcare in our country. Speaking about the different technologies, so we have multiple technology platforms in the modules, right from the community health workers to the patients module, doctors module, the admin that is able to give complete data snapshots through multiple ways. And that has been our platform and technology has been used in multiple geographies, especially during the pandemic, wherein iKure was responsible to deliver telehealth for the entire state of Nagaland. And as you know, Nagaland is one of the most remote terrains in our country. And we were able to provide telehealth for 192 centers and the sub-centers with the government of Nagaland. In addition to that, iKure has extensively worked in the Jharkhand region, West Bengal, Odisha, Karnataka, and several other states. Towards that effect, iKure has also brought in some of the other important aspects, the important aspects of sustainability. Because we know for sure, if you are running through just a donor-based model, the problem is in many cases, the donation stops and so does the impact on the ground. So we were able to figure it out that is it really possible to create these community health workers and turn them as community health entrepreneurs. So iKure has created a sustainable, scalable, frontline community health worker model. And in this model, our community health workers is able to become sustainable within a period of 2 years. And now we are able to not only provide holistic, affordable, accessible, quality healthcare to the population, we are able to bring and transform these village women and make them as community health workers by bringing them livelihood opportunities. In many cases, these community health workers have the potential to earn anywhere between 6,000 to 10,000 rupees per month, which is a very comprehensive amount for themselves and their family members. So iKure is a unique model wherein we are able to integrate technology with healthcare delivery through the frontline community health workers. And now we are emerging as a collaborative platform to deliver holistic healthcare. Over the period, we have touched more than 20 plus million population. We have treated more than 3 million underserved patients in India. These are some of the innovations and models that we have worked upon. One of them is the mobile board clinic. As we mentioned that there are many geographies wherein access to the healthcare in some of the geographies has been extremely difficult. So iKure has started providing healthcare and setting up clinics, delivering and deploying the community health workers in some of the remotest areas like Kumirmari, which is one of the most remote islands in Sundarbans. And in just less than a year, we have been able to see a transformative change. We know the work that we have done is minuscule compared to the huge amount of challenge that we are there in this community. But definitely the step has been taken. And these are some of the positive outcomes that we have seen, especially in the last 1 year alone. While we have been working, we also understood that there has been extreme, deep impact of the, impact of climate change on health. And definitely with regards to the problems, we figure it out that can we design different KPI models for which, you will have the other speakers like Mr. Soumitra, Manish, they'll speak about that, and as well as Golden. These are the different factors that is plaguing in the community. I'll quickly talk about some of the other innovations. The important innovation is on the deployment of artificial intelligence, that in case the patient is speaking with a health worker, can we provide large language models backed by artificial intelligence, meaning that in many cases, the health worker may not be able to reach out to the doctors on time. So in this case, we are partnering with Community Science Alliance, which is backed by researchers from Harvard, Yale, Albert Einstein College of Medicine in New York, to create these large language models for around 50 pathways, ranging from diarrhea, pain management, fever, menstrual hygiene, and several other cases that will improve the communication between the patient and the health worker, and thereby improving the trust factor within these people. In the month of February, we conducted something called as Unconference in Sundarbans. And we were able to bring in experts such as Mr. Soumitra on the ground to experience the insights. We were able to bring the farmers, honey collectors, fishermen up on the stage and share the problems that they have witnessed in the last many, many years. We were able to see many fascinating challenges and the insights that were there, which was otherwise unknown. And especially with regards to the impact of climate change, which we will be talking soon. I would also like to speak about the living lab. So iKure is setting up a physical living lab very close to Sundarbans in the Baripur region, which is around 1 hour from the Sundarbans region. The very purpose of living lab was, is it really possible to bring some of the world-class experts, researchers, and practitioners to be very close to the community, understand the problems on the ground, and create long-lasting solutions. We are really happy that this living lab, which has been architected and designed by HDR Incorporation New York, which is one of the top 5 architects in the world, and that has won 2 international awards for the sustainability. This building has been designed keeping the wind energy, solar energy, and the traditional architecture in mind. And the objective of this innovation is that can we bring some of the world-class innovations to the communities which matters the most? Especially during the pandemic, we have seen that we all have been working in silos. The healthcare infrastructure, state and central governments, pharma companies, medical device companies are not talking to each other. And iKure's objective has been, can we create a collaborative ecosystem so that if there is any innovation which happens in any part of the world, can we bring to the communities at the fastest possible time so that we don't have to chase the virus and we are up against that in a much more stronger way. So with this, I would like to conclude my session. Thank you so much.
Thank you, Mr. Santra. I now request Mr. Soumitra Ghosh, Chief of Party, USAID, ABD Associates, Afghanistan, who brings over 20 years of experience in managing impactful public health programs across various regions. I invite you to please address the gathering.
Thank you. Good evening, everybody, especially the members of the BSG, my co-speakers and participants, and ladies and gentlemen. Thank you. First of all, thank you for inviting me to join this collaborative platform to share some insights and ideas to address and find sustainable solutions to these challenges which are being faced by the communities in Sundarban. The impact of climate change, as Sujay aptly sort of demonstrated, on the environment and communities in general, but particularly in a place like Sundarban, is of grave concern. It negatively impacts the lives of residents in the Sundarbans, including it affects their dignity and inherent potential to adopt any kind of self-induced change and create value through social actions. Of course, this necessitates comprehensive solutions to address a series of interrelated problems. It's not just a health problem or an education problem. It's multifaceted problems that needs to be addressed, even if one wants to sort of improve the health of a certain community. A collective and integrated approach, therefore, is essential to assist the communities achieve this sustainable change and uplift the overall well-being in terms of health, confidence of the people, courage to live in that difficult situation, the wisdom and happiness, desire to improve, and self-discipline that is required to live happily in that kind of a environment. In this context, the proposed collaboration of iKure and BSG is of high significance. I would like to thank iKure for offering me an opportunity to visit Sundarbans this year, early in February, and witness the ground reality there. And I would like to share some of my observations, some of the challenges that I saw, and what are the opportunities that I saw, like existing there that can be tapped effectively. First of all, Sujay has talked about the basic problem of the rising sea levels have impact in different ways. The islands are disappearing, and as a result, the agricultural land is decreasing. Secondly, with rising sea levels, the increasing salinity in the water and soil, it is severely threatening the quality of soil and the crops produced there. Secondly, the changes in the very basic occupation, which is the fishing patterns of the people there. And C, the deteriorating health status of the local residents. I will explain each of these in a while. Secondly, we talked to some of these fishermen, we talked to the honey collectors, both men, women, and they described that the cases of tiger attacks has increased considerably over the last few years, and this is due to a greater number of inhabitants going deep into the forest areas to catch crabs, fish, and collect honey, because they don't get them so easily. Thirdly, as I said, as the agricultural land keeps decreasing, it is resulting in large labor out-migration in the recent years. Importantly, what I noticed when I was talking to the younger generation, they are losing interest in the traditional occupation like this fishing or honey collection. They don't want to follow that parents, the occupation which has given them, livelihood for so long. They're mostly looking out for other opportunities, and many are opting for migrant labor jobs, as Sujay said, that in various parts of India, particularly Western India and Southern India. Another interesting thing that we found that, this male out migration is making the women and children increasingly vulnerable. The actual burden of the calamity is not being borne by the man who has gone out. It is being borne by the women and the children who are growing up there. The increased salinity, as I said, and the various changes and the stress due to these calamity impact the physical and mental health of the local population. Look at the incidence of non-communicable diseases, whether you're talking about hypertension, whether you're talking about diabetes, cardiacs, and respiratory problems, it is at a much higher than the average level. Secondly, the vector-borne diseases are very common, the malaria and the dengue with all these problems. The large proportion of women and more than 1/3 of the children are chronically malnourished. And lastly, but not the least, the incidence of sexually transmitted infections, including HIV, seems to be on the rise through the migratory male partners of the women living there. These extreme weather events cause severe damage to the infrastructure and the delivery system, whether it's education delivery, health delivery, doesn't really matter. You will see, like if you are there, that every delivery system has been affected by these. Unfortunately, the lack of governance, stewardship, and policy support deny people to access the quality services in these places. Everybody is aware of these problems, but there is not adequate support. Whether you're talking to the political leaders or the local government officials, they're all aware of the scheme, but how many of those people are actually able to access those schemes is a big question mark. So given that, we need an approach that can help achieve improved health and socioeconomic well-being of the people of Sundarbans, with specific emphasis on women and children, as I explained, because they are the worst affected segment of the population. And for that, we need to adopt an inclusive, eco-friendly, sustainable healthcare delivery. But as I said at the very beginning, the healthcare delivery is so linked to the other facets of life that it also needs to include the livelihood practices. Only a people's movement through empowerment of local population, primarily women and adolescents, can bring about sustainable positive change to the environment, as well as the community in Sundarban. Effective empowerment of women assumes high significance to protect them and children and create a resilient social system to combat the challenges as it keeps coming. Because it will take longer time to reduce the incidence of those natural calamities. In this context, iKure's unique combination of the primary healthcare delivery model with technology and innovation is very, very critical. And that is supported by two things, which is very important. One is the network of sustainable and scalable, this community health entrepreneur model. So they start with a 100% salary model as a health worker working in the community, but gradually they transition to a level where their salaries are not to be paid by program, but they start earning through incentives. And that's a wonderful model that they have been able to sort of run there and scale up over a period of time. The second thing is, as I said, it's a multifaceted problem, and therefore there is a need for a collaborative platform connecting the market actors, government bodies, and multilateral agencies, offering a great opportunity to address these issues in a comprehensive, collective, and in an integrated manner. I think the timing of this webinar on the impact of climate change on health in the Sundarbans is immaculate, with the G20 leaders and us too discussing the same issue on climate altogether at the same time. With BSG's commitment to the personal, spiritual, and community development and experience of supporting disaster-stricken regions, this partnership with iKure can contribute to both women's empowerment and the identified health focus areas, which I've already talked about, includes malnutrition among women and children, in particular anemia, sanitation and hygiene, as well as other non-health areas like education and livelihood. So with that, I would like to thank you, and once again, I would like to say that there is a beginning which has happened in Sundarban, and this is a very small effort, and this needs to be supported, and this needs to seek support from others, and together this can be scaled up and be made to impact this community in a bigger way. So with that, I will end here, and any questions I would be ready to answer later. Thank you very much.
Thank you so much, Mr. Ghosh. Now please welcome Mr. Manish Mitra, Country Director, India, and Project Director of Yuva at Pathfinder International, with over 2 decades of experience in the non-profit sector. I request Mr. Manish Mitra to address the attendees with his speech.
Thank you so much, Alicia, and thank you all, particularly BSG members, for inviting me, and a warm greetings to all the audiences. I'll start very briefly with Pathfinder International. So many of you be knowing about the organization, but just briefly to say about Pathfinder International. So we are a global non-profit organization having footprint across Africa and Asia in over 25 countries. Our primary work is on improving women's and girls' sexual and reproductive health. And a lot of that has a very strong intersection with climate resilience, climate change, as my previous speakers have very strongly established the correlation between vulnerabilities, women, children, and health. So from that perspective, Pathfinder has a very strong portfolio and body of work on intersection of climate change, climate resilience, climate adaptation, and it's winding up with this overall public health approach. I'm just presenting to you a small example of our work, which again have been funded by one of our corporate partners, Takeda. This program is looking at advancing how do we advance women and girls leadership towards better health and climate change resilience. So if you look at the overall thing, for us, climate resilience, gender equity, and health are inseparable. And when we look at the challenges that are faced, I would not repeat them. I think Sujay and Mr. Soumitra have very categorically highlighted the different challenges that the world faces now. And particularly when it comes to vulnerabilities, we all know that the most vulnerable member of a household are the women and the girls because of their gender status, inequitable access to resources, and control over decision making. So from that perspective, Pathfinder approaches its public health program in terms of environmental sustainability with multi-pronged approaches. And the first one is to look at how we can improve women's and girls' agencies by supporting them with tools, knowledge, networks, and resources, not only to survive and build, but also actively participate in conservation. Pathfinder strongly believes that when it comes to work around climate change, most of us do a lot of heavy lifting around resilience, around adaptation. But we also strongly believe that communities need to play a very strong role in terms of conservation and do their bit, not only to see that how their communities are resilient, and adaptive to such shocks, climate shocks, but also how do we undermine those shocks to prevent them to come in future times. Second one is talking about resilient health systems. Our own experience of work over 60 years have very strongly indicated that when we look at a climate crisis, health systems are the one which gets crumbled up. And we have though it was not a climate crisis, but it was a crisis in a bigger measure. COVID, we have seen how the first impact was on health services. So one of the things that we are strongly working on now is that how can we support health facilities, health service providers to transition from a much, resource dependent model to a renewable model where we are looking at establishing green clinics. We are supporting the community providers to use and harness the local resources that are available within the community and bring in a lot of community ownership into this whole mechanism of working. And third one, I would like to very specifically highlight that we do have a lot of research, evidences, and other things generated on climate change, but two things are very strongly missing on that. The gender lens. There are very, very few research papers or evidence notes which actually talks about the disproportionate or the amount of the vulnerabilities that women and girls face and how they are contributing to bring to the resilience and the adaptive measures. So we strongly believe that Pathfinder needs to play a very strong role in creating those evidences and learning across the things. So that is the overall view, Alicia, about overall Pathfinder's approach. I'll be happy to take any questions if that comes through. Thank you.
Thank you so much, Mr. Mitra. Lastly, I request Mr. Golden Franklin, AVP Innovation and Strategy at iKure Techsoft Private Limited, with over 15 years of experience in program management, who has enabled impact with 50 plus non-profits, to please share the way forward for iKure.
Thank you, Alicia. It's a pleasure to actually join this webinar and to be able to share my thoughts, and especially about what we have been doing in the Sundarban region as iKure. I think last 6 months I've got multiple opportunities to visit the Sundarban region, and not as a tourist, but as someone who is designing interventions and trying to get some of the solutions on the ground, especially related to healthcare, along with the team that's very, very committed on the ground. And that, I've traveled across multiple regions, but this has been a very, very unique region that I have traveled to. I have seen a lot, whatever Soumitra spoke about, whatever Sujay spoke about, I was able to see that on the ground, right? You can see the landmass decreasing. It's so significantly visible. You can see the issues regarding agriculture. You can see the issues regarding malnutrition, or what women are facing over there. Healthcare is a very distant thing for them to be as an available resource, right? So we were able to see all of these things, and in such a scenario, iKure has begun a small and humble intervention in the Sundarban region. What we are doing there is a small pilot, beginning with about 6 different islands. So we have presence in about 6 different islands, and we have reached so far about 7,000 people through our intervention, where we have been able to create awareness, provide healthcare services, and also bridge bridge the technology services that we bring through diagnostic services on the ground. So far, our one of the interesting things that I'd like to share to this group is when we did our baseline survey, we were able to see that 58% of the people that we reached out to were actually women, and only 42% being male population. That itself shows the significant amount of migration, and because of which we are able to meet more number of women. And another very interesting fact, I'm just pulling out 1 or 2 facts. 52% of the population that we surveyed actually reported hypertension. This project that we are looking at is specific on hypertension, and we were able to see that 52% were actually suffering from hypertension. But more interesting is only 3% were taking medication for it. That shows the need for services in this region. If we go for an even more broader demographic study, I'm sure we'll be able to pull up so much more, requirements, and that itself would be something that so much to do in terms of interventions that we can do. But our intervention there has been, we have about 15 community healthcare workers who are from the region, who have been trained by us and have already started providing services of diagnostic services, awareness, and also linkages to different facilities. They have been able to already start these services on the in the 6 islands that we are working in. We have so far been able to introduce telemedicine services in the island. We also are in the process of establishing 2 clinics, which will also be equipped with pharmacy. All these services, a proper clinic, a proper pharmacy is not available currently in the island, except for one which is very close to the mainland. So, we'll be creating some of these services in really remote areas. And also we have previously also run our boat clinic. So thereby trying to make healthcare as much accessible as possible. And our healthcare workers have been, continuously working on awareness generation, providing diagnostic care services at the doorstep through the different technology products that we have brought in, and also, are in the process of also delivering wellness care products right there at the doorstep. So all of this is a small, effort from our end. We know that there's a lot to be done. So specifically talking about the next steps that we want to do, from these insights that we have got on from the ground and from the different experts that we have, like Soumitra or Manish, and not only that, I'm sure in this group there are a lot of experts who can contribute towards a strong pilot design. We want to take all of the learnings and the expertise available towards the next stage, which will be a pilot design, a project design that we can put together. And then maybe we should be able to align resources and start a small implementation that we can do as a holistic project that will focus upon social well-being with a lot of significance brought specifically upon women and children. And, thereby we should be able to create an impact. There is a lot that is required. When so many of you who are listening can actually be engaged in this initiative. There is expertise required, I said that, and then there is capabilities required, to implement, to do research, to do studies, to be able to do, more holistic approach on the ground. There are resources required, tools, kits, methodologies, and not to mention, funding. But then all of this is required on the ground if we really need to do something significant that will actually create an impact. So what we aspire to do next, and along with the discussion with the experts, is that we want to create a common interest group. Maybe, if it is about education, we create common interest groups about education. We can create about malnutrition. We can create about women health. But we can create these common interest groups, and maybe the team can actually help us to identify different experts who could contribute towards this, and that can help us to be able to design a project and then be able to take it to implementation. So that's how we look at not this being just about having a lot of knowledge, but I think it is going to be more about implementing. Because what my personal view is, there are a lot of people who come there for tourism. But for us, this is not a tourism. For the inhabitants, this is a reality. And for us, this is a passion that we want to create an impact. So that's what we want to make it possible. And it's an open call that if you're listening to this and if you feel that you have an expertise to contribute, then it's an open call that come and create a positive impact and help us create a positive impact. So that's what I would like to share to the whole team. Thank you for this opportunity.
Thank you so much, Mr. Franklin. I would like to thank all the speakers for your valuable sharing today. We are receiving insightful questions from our audience. I invite our panelists to share their insights on these questions as I ask them on behalf of the audience. So my first question is to Mr. Sujay Santra. What are the specific roles or opportunities available for individuals who are passionate about contributing to the project on the ground in the Sundarbans? Are there volunteers or internship programs in place?
Yeah, so of course, there are multiple opportunities at iKure wherein you would be able to participate, ranging from being on the field as field volunteers, doing internships, If you are passionate about the research and the data collection, that would be another area of contribution, maybe on the clinical side, on the climate impact side. So based on your interest and the opportunities that we have, we can definitely find a common synergy for us to explore and take it from there.
Thank you so much, Mr. Santra. My next question is for you, Mr. Soumitra Ghosh. You have extended an open invitation to other organizations and stakeholders to join your cause. How can individuals or organizations who are interested contribute to or support iKure's projects in the Sundarbans?
Okay, I'll just take off from where Sujay left. There is a dearth of data. There is a huge gap in terms of information and data in Sundarbans. So therefore, the researchers, whether it's interns or professional organizations, doesn't matter. We need researchers to come to create knowledge, to manage knowledge, and share knowledge about the island from people's lifestyle, the problems, the burden of disease in every sense. The second thing is that this requires a number of different kinds of solutions. So therefore, and it's a very costly area to like implement any program. And so therefore you need, this med tech companies, the healthcare providers, the device innovators to come up with some cost, effective solutions, which could provide a doorstep asset-light kind of solutions, which can keep the cost and the investment low, and that is the way one would be able to justify the value for the money or the value for the investment that you were looking from various donors and the financing companies. You need the government. You cannot change the situation there without the government support. You need advocacy, a lot of research papers to create, a push and a nudge for the government institutions to move. And of course, there is always need for money, and therefore the multilateral agencies, the foundations, and the CSR. And personally, having worked for nearly over 30 years with USAID, I mean, what I've seen is that, if there is a good concept note, if there is a good idea, there is no dearth of funding available. So I think it is available. We need to create that sustainable solution or an idea-based concept that we can sort of present to the funders, and I'm sure there would be money flowing in. Thank you.
Thank you so much, Mr. Ghosh. My next question is to you, Mr. Manish Mitra. You shared about how Pathfinder International has made notable strides in the area of planetary health and climate resilience, addressing the interconnections between human health, environmental sustainability, and social equity. Can you please provide insights into some of the key initiatives or projects you have undertaken in this domain and the impact they have had on both local communities and broader global health landscape?
Sure, Alicia. Thank you so much again. I would again start with the presentation. So that's a program that's being implemented exclusively in South Asia. We know it's a multi-country program, and I think we have enough idea about the difficult situations in terms of climate crisis that South Asia faces, beginning from flooding, salinity, extreme heat, then and what sort of impact it leads. So from that perspective, our program, which we design, has three critical components, I would say. It has a component which advances the health of the population that we serve. It looks at equity, and it looks at creating locally led solutions. And I think, again, Mr. Soumitra has emphasized on the nature of solutions that needs to be created. When we talk about lean innovations, it has to come from communities. It has to be generated from communities to sustain them. So that's the broader thing. Similarly, if I briefly touch on interventions in Africa, we do have very strong interventions on population, health, and environment, where we are looking at different communities, and our stakeholders are not only women and girls, but a very strong component also is embedded into the school programming. So we have to bring in those young people into the discourse. We have to create, and it's not about now a fashion statement. I think each one of us are seeing the impact of climate change, right? So that is something. And in terms of outcome, yes, we are an organization who focuses on public health. So obviously our topmost is to see that how health-seeking behavior has improved. But what are the add-ons, the value additions? We have seen increased in household incomes because of these interventions, which has a very strong focus on environmental conservation by adopting alternative livelihood mechanism, eco-friendly alternative livelihood mechanisms. We have programs in very remote areas in Africa, which looks at conservation of lakes with fishing communities, with subsistence farmers, which has led to better natural management practices, leading to reduction in deforestation, leading in improved not only the household economy, but also the environmental health in a perspective. Thank you, Alicia.
Thank you so much, Mr. Mitra. My next question is to Mr. Golden Franklin, which many is in the audience would like to know. Can individuals with expertise in the fields like education, healthcare, environmental science, or community development collaborate with iKure to design and implement specialized projects within the broader initiative in the Sundarbans?
Alicia, I think if there is one thing that everyone on this webinar believes, that's collaboration, right? So, and that's a need. It's a real big need. Yes, there is a lot of opportunities. If you want to be part of creating a strong impact in the Sundarbans region. We have a humble start there, but you could, be able to contribute through multiple ways. Some ways could be staying connected with us, stay connected with what this problem is and what we can do about it. So first thing I would say is be connected with us and try to see if we can design something together. Second is also come and give us feedback. Whatever we are taking as steps, when we do the project design, when we try to take it to implementation, come and give us feedback. That's the way that you can contribute. You could also be able to contribute if you are able to think about any collaborative project that we can do together. I think Soumitra talked about it, that we need to do collaborative stuff so that we're able to touch multiple aspects for a stronger impact. And then, I think also Soumitra touched about it because this is very important. Bring innovations that can be tested there. That can make a significant impact. It can reduce time, cost, and too much more. It can create a stronger impact. Bring innovation or refer your innovation. Bring your network and help us to be able to connect with your network that can really bring impact and more number of people who can come and contribute here. And ultimately, I think the last would be help us mobilize more support for the people over there. We are there to be able to take the project on the ground and to be implemented collaboratively. So I think we always have an open mind and an open heart and an open hand, trying to do more so that there is stronger impact. So yes, certainly there is an opportunity for everyone.
Thank you so much, Mr. Franklin. My next question and the last question is to Mr. Sujay Santra. In your presentation, you have mentioned that iKure's approach has evolved from healthcare to a more holistic one. Could you elaborate on the multifaceted challenges beyond healthcare that you have encountered in Sundarbans and how iKure is working to tackle them?
Thank you, Alicia, for the question. So iKure, when we started working in Sundarbans, the problem in Sundarbans, as we all have heard, is not very straightforward. There are multiple challenges with regards to logistics, with regards to education awareness, with regards to the livelihood challenges on the ground, especially as we mentioned that the major male members of the communities are working outside in search of livelihood opportunities, leaving the women and the children left behind in the islands. We have also problems about water, sanitation, the environmental conservation, the disaster preparedness, and many others. So iKure has been focusing on the multifaceted problems in a 360-degree way, wherein our frontline health workers has been instrumental in providing educational awareness about different things on the ground ranging from the healthcare issues, menstrual and hygiene, hypertension, as Golden was mentioning about, the programmatic intervention that we have worked upon. The whole idea was that in many cases, the right information is not able to reach to the communities in the proper way. And our objective has been to bring such information to the communities and help them understand the long-term effects about climate change, about healthcare to the communities in a more holistic way. Apart from that, we know that the problem that we are trying to solve is huge. And the only way that we would be able to solve is in a collective way. And in this collective way, the community also has to be participatory in a much more active way. As Soumitra was mentioning, and as iKure conducted unconference in February, our objective was that unless and until we are able to bring the community, especially the farmers, honey collectors, fishermen, and the other communities to be a party to this whole thing that we are intending to do. And in addition to our iKure, apart from the other organizations, including the different officials within the state and the central governments, unless and until we are able to bring all of them together within the same platform, we'll not be able to move much forward. And that is where we have been trying to solve that by bringing in different solutions in different ways to solve this thing. The other important factors, as we all have been speaking about, is the right information at the right time through technology. So we have been working on different ways to bring the different innovations through different innovations and getting data insights of the different models that are working on the ground, and how we would be able to understand that what has been the repercussions in the next 6 months, 1 year, and down the line. And through these data insights, it would be much more easier for us to understand where are we going right and where we need to improve. So through these collective efforts, as we mentioned, in terms of education awareness within the communities, livelihood opportunities, the conservation on the ground, and right kind of information, we are able to create a holistic environment within the communities in Sundarbans.
Thank you so much, Mr. Mitra. Santra. With this, we close our questions and answer session, and as we conclude our webinar, I have the honor of inviting Mr. Vishesh Gupta, Chairperson of Bharat Soka Gakkai, to deliver closing remarks with us.
Yeah, thank you, Alicia. Once again, a very good evening to each one of you. And first of all, I would like to thank my dear friend Sujay and also Mr. Soumitra Ghosh and Mr. Manish Mitra for coming today and sharing their thoughts and ideas with us. I think whatever you have shared, I feel that Sundarbans is not just a case study. There are people who are living there and they're affected by everything which happens in those islands. In his presentation, Sujay talked about the unconference, the conference which they organized earlier this year. And time was short, otherwise someone from BSG would have certainly gone and attended that to have that first-hand experience of what each one of you have shared about Sundarbans. So I would like to share 3-4 points which are my takeaways from the invaluable inputs which each one of you have shared. I think the first most important point, as this seminar is about planetary health, and Manish mentioned that climate change or planetary health is not a fashion statement anymore. I mean, it is something which is experienced by each and everyone on this earth. And therefore, each and everyone who lives on this planet has a responsibility, both individually and collectively as a community, to contribute towards, changing the curve of this climate change, which is affecting everyone today. And the second thing is about what Soumitra shared, that how planetary health and human health, they're all interlinked with each other. And when we also talk about, sustainable development goals and sustainability focus initiatives, when we work towards one SDG, of course, it affects many other SDGs because they're all interrelatable. So what is required today is a holistic approach, an approach which involves people, community. And in Sujay's presentation, I felt one of the major takeaways which I had was about empowering the local people and empowering the local community. So when we are looking at Sundarbans as an example, and if we want to make some changes, transformations there, we cannot expect that all transformation will take place because of many people moving into Sundarbans for a short period of time. It is few people who go there and how they can involve the local people. Like the example of the village woman who so far has been a homemaker, and now the way she is contributing to the overall health of the community. That's a wonderful example. Of course, it needs a lot of effort and thought process, to make it happen. But I think that kind of a model is something which is required. So as far as BSG is concerned, our strength is our members. Like we have like 277,000 members across this country. And many of them are very passionate about finding solutions for planetary health and all DEI initiatives, etc. So as far as Sundarbans is concerned, I'm sure that many of our members, almost 1,000 of them, are attending this webinar today. Many of them would have felt very strongly about the cause which we have discussed in today's webinar, and especially Golden, frankly, what you shared about what all an individual can do, in terms of a pilot project or in terms of common interest groups, etc. I'm sure there would be few members of our organization who would like to come forth and volunteer to iKure to see that how they can participate, in the rebuilding, reconstruction of the Sundarbans area. So what I would like to suggest is that to our members who are attending this webinar today, that all those who are keen to learn more and contribute, they can write to Alisha, Jaya, and myself. And I think we'll need to get together with iKure in a more detailed discussion manner so that we can work out as to what can be the next possible steps. So for to that extent, I feel today's webinar is like cutting the ice and opening up the forum for people to think and decide that how they can contribute and participate. So the other strength which we have in BSG, which we can bring on the table, is that more than half of our membership is youth, and the power and passion of the youth is what is required today to transform the situations which we have across the globe, Sundarbans being one of the live examples. So I feel that many youth who are also SDG experts in their profession amongst our membership, I'm sure few of them would like to come forward. And Sujay, understand from you and Golden in more detail as to what is possible to do from their end. And the purpose of today's webinar is to really, excite such young brains and minds so that they can come forward and involve themselves in this ground activity. Because one thing which we believe in our organization is action. And I think SDGs, sustainability, and handling issues like climate change and women empowerment, women health, all these need action on the ground. And it's so wonderful that all the three organizations who are part of this webinar today, and of course BSG, are all taking action on the ground. And I think that is what is required, like what Manish shared about the initiatives we have taken in Africa. And I have traveled to a few countries in Africa because of work. And I firmly believe that Africa is one place where a lot of such initiatives are required, because the situation there is beyond our imagination. Except capital cities in most of the countries in Africa, other cities almost look as if they are inhabitable, but there are many people who live there. There are many women, children who live there. So I think I'm sure that there would be a very good response from our membership as a result of today's webinar. And probably we'll work out as to how to discuss this in more detail, Sujay and Golden, with you and iKure, and take this forward. So once again, I would like to thank each one of you for coming today, and personally look forward to working more closely on the ground, with your wonderful organizations in the future. Yeah. Thank you very much, and over to Alisha.
Thank you so much, Mr. Gupta. As we draw the curtains of this enlightening sustainability webinar on planetary health, I want to extend my heartfelt gratitude to each one of you for being a part of this event. Your presence, engagement, and thoughtful questions have truly enriched our discussions today. On behalf of Bharat Soka Gakkai, I extend our warmest thanks once again for your active participation. Stay safe, stay inspired, and let's keep on working towards making our planet sustainable. Good night and thank you.